Welcome, everybody. This is our first round of playing with the idea for a answering of all the questions. People got a lot of questions, Eric. Dr. Goodman, Coach Salas here. And Eric, are you going to be able to share some information today?
Oh, yeah. I got lots of information to share. I'm excited. Looking forward to it.
Right on. Yeah. So for everybody that's joining in, we're going to find a flow of trying to get these in a couple times a month so we can answer your questions. It's a fun way that Eric and I have come up with to engage with the community that is our online streaming platform. And so I've gathered up the questions of the day, and what I want to give everyone is a summary so you know what to expect, and you can choose to stay on board and listen to what we're going to discuss. Or if you feel like you don't really have any questions there, cool, we'll see you later. But we're going to dive in today, all things on-ramp, because everyone's asking with the new program, should I go back? Should I do this? Should I do that? So we're going to discuss all things on-ramp. Then we're going to get into decompression breathing, specifically questions around how should I be holding myself when I exhale? We're going to dive into breathing and transitioning through exercises, always a popular question. Then anchoring with hinges, specifically integrated hinges. And then lastly, where do I go after baseline? Can I be re-released into the wild, Eric, is going to be the question. So let's get on to all things on-ramp. So Eric, give us kind of a play-by of what your vision is for people, for on-ramp, for it coming to life.
So my vision has never changed in foundation training in any way, shape, or form. It's been, let's get as much information about this very specific way of moving the body to people as we can. And I've had a very distinct way of teaching it for like 12 years or so now. What it came to be is that I teach at a certain pace and a certain complexity that doesn't serve everybody. And there's a population that comes to us that's in pretty significant pain sometimes. Not so much that it's going to turn off their back pain immediately, but they've got to work through some things. They really have a lot of, be it past surgeries, or maybe they've got like a nervous system issue or multiple breaks throughout their rib cage and other bones in their body that are healing as they're learning foundation training. And that's what birthed on-ramp. It's kind of like, well, how do we get the pieces of these movements that can be very complex into people's brains and bodies in a way that's really safe for anybody at any time? Not that FT is not safe for people, but if you're in acute spasm, if you're in acute problematic pain, it's very hard to just learn a founder and to listen to me or you talking you through. It's like, okay, come on. So this is much more of a piecemealing of what is the foot positioning and how does that strengthen the leg? How do we then take that into anchoring? How do we take anchoring into hinging? When you're anchoring and you're hinging, that stability in the pelvis, what are we using that for? Okay, now let's get into breathing. Now that we have that stability line understood, let's move into a little bit of breathing before we even go into decompression breathing. What are we using breathing for? How do we improve our posture? How do we improve our day-to-day with breathing? Then we get into very specific directives of decompression breathing and how to use that in daily life. The third principle of work integration comes in later, and it's like 1, 2, 3, 1, 2, 3, 1, 2, 3. And once you've done the on-ramp program, every other workout that we have, you have the basics for it. You understand the fundamentals really well.
Yeah, I like to, when people have asked me, what should I go back? How should I use it? I kind of just give everyone the simple, like, doesn't matter if you're starting or if you've been doing foundation training for a while, integrating on-ramp is going to work almost like a highlighter for you. Like, hey, am I truly feeling X, Y, and Z when I outward anchor? Am I feeling the sensations that they're giving me a moment to really hone in on when I inward anchor? Am I feeling X, Y, and Z? Like, I feel like for the people that are kind of, because it seemed like, I don't want to say there was a reluctancy, but there's a lot of questions around almost like wait a minute, am I backtracking by going and doing on-ramp when I'm already at, phase 4 of baseline? And I was like, no, look at it as like this. You're going to go do this, and then it's going to let you put a highlighter on your exercise. Am I really getting, all the juice from the squeeze that I'm looking for, right? Like, when we go into this stuff, like, you know, you and I will do with people and we'll just be like, oh yeah, squeeze the fingertips, do X, Y, and Z. Our mind is there's very specific muscular activations, very specific positions being reinforced. Whether or not the person's feeling it or finding it, that's the other question, right?
I would
So go ahead.
I would challenge anybody that's been doing this work for a really long time. Anybody, like your your whole routine is I'm nothing but surf squats, gorilla lifts, and windmills. Man, that's all I do. Go back to this. Basics are best always. In work like ours, in medicine, in science, in art, in building, basics are more important than any details you learn further along. Go back, relearn the basics. I bet you'll kind of learn a few things maybe for the first time. Everybody needs to do it. Jess goes back to the basics. I go back to the basics. We all do it all the time because that's kind of how you learn the best.
Yeah, hone. One might say hone the foundation of your foundation training.
Yeah, right?
So Eric, on that note, when you pick an exercise for yourself, when you're doing something, what's a foundation exercise you did today? When you talk about going back to the basics, because I'm in a process of that kind of consistently, but what did your foundation practice look like today for someone that is kind of like, what's Doc Goodman do?
Yeah, so I had a little joint injury in my thumb about 3-4 weeks ago, just paddling, and it wouldn't quite heal right. So I started playing with some electric stim stuff. And this morning I was doing a little bit of stim on my left arm for a bit. So the day actually started with me playing with the very nuance of that sphere and just kind of playing with the web of tissue here. That lasts like 3-4 minutes, then I put the machine away. But after that, I started getting into like my typical lifting. So I have a heavy kettlebell that I like to play around with, and I always load with squats, forward folds, and like a gorilla lift movement. Kind of getting into the gorilla lift, not necessarily perfect supination like step, textbook, but using the base position, moving around it, kind of gathering things into me from that position, pushing them away from me from that position. I use the kettlebell kind of like a rotor sometimes. I kind of steer it around, and it's amazing how much your whole body works in that position. So it's like it gives me the base position, and I could do a 10-minute routine in that stance, moving that kettlebell all around. And it's exhausting with the stance.
Well, it's really, you've done a gorilla lift so much, so often, template over the years that you can play with these crazy variations, but you always know exactly what you're looking to feel through. I feel like it's the sensory of so much time under tension and doing the practice. And that's what, when you tell people, hey, really get down your fundamental foundation, that's what goes into my mind is, there comes a point I look at as where you shift from this, like, oh, am I doing this, to like, oh, I've got the connections to, there just becomes another level of sensory that you start to feel in your body, almost like a balancing, if you will. Go ahead.
The poses mimic positions that you have to do in life. Especially if you're athletic, you're going to go through these ranges of motion. So what you're looking for, and I want to take a moment to explain what I'm feeling in my legs in a gorilla lift. Throughout that entire thing, my feet are spread into the floor exactly as I teach everybody as we teach. I'm using that web to kind of contract my shins against my calves. The deep leg muscles are engaged. The whole ham bone, think of a ham bone that's cross-sectioned. You see all those big muscles around it. That's what my leg is feeling like. You might hear a little bit of a 5-year-old having a tantrum upstairs. Sorry, guys. It's just the way it works. I got young kids.
It's a 5-year-old.
It's a 5-year-old. Yeah, she's doing homeschool. So, but that being said, you're looking for that. You're not looking for like, oh, my quads are burning so bad. How do they hold this so long? That's wrong. That's not a gorilla lift. That's not the right position. It's my hamstrings are loaded. My adductors are fried. They're holding on so tight. My IT band is like wrapped and held, and I'm like pushing against its outer boundary as my hamstrings are just holding me. They're keeping me tight. I have this outward push, and that makes sure that my hips are guided and all that pressure is constantly going through my feet. You'll never watch me roll up like on 2 points. And when I'm doing it, I'm holding into the ground really hard. And that's the whole purpose of that pose, is make sure that when you're moving your body around, it's just as strong as it can be in hip flexion in strong pressure through the propulsion muscles of the IT band and in strong stability tension of the inner groin muscles at the pubic symphysis.
Yeah.
So that's
Yeah.
feel.
Gotcha. Yeah. And for anybody that's wondering, basically what Eric was describing was his inner thighs, his outer thighs, the back of his legs, and kind of no quad at all. Like you said like you shouldn't be really feeling that, right? And but by the way, I love what's that?
So as they can tell, this is why we have the on-ramp program.
Yeah, yeah. And no, I just love too, like I love the little ones in the background because my thing is this is life. Like everybody, this is our lives. And my goal with us doing this, Eric, is that I want people to get to have the authenticity of engaging with you and I. I'm a bit of a gypsy. You're a bit of a family man. Teamwork over there.
You should see Jen just shaking her head right now. Like, oh man.
Yeah, it's all good. It's all good. Great. But that was a great dive in, Eric. And, you know, like, just to reiterate fundamental is, I've got, you know, I like to take one or two exercises and thread them, you know, into the Tabata formats. And so for anybody wondering, it's 4 minutes long, 20 seconds of work, 10 seconds of rest, where I basically right now I'm doing a standing decompression for a full Tabata. And I find that it lets me kind of like do a couple rounds and really hone in on super details. Like I'm noticing a big toe thing on my left foot, and I'm noticing same side when I'm in that sphere. And the other Tabata I'm doing right now is a spiral rotation, and noticing just when I'm really reaching and rotating, a tendency to need to turn up connection there. So long story short, what I'm getting at is like, don't be afraid to just spend time in fundamental details, because this is not a, hey, get from point A to point B as fast as you can. This is a process. This is a strong medicine, if you will.
I think anybody that's doing foundation training that really gets into it, you kind of do some piece of it the rest of your life to some degree. Like you don't have to, you're not doing necessarily the exact routine, the perfect protocol, but you've learned it so well after a little while that you can implement it a few minutes at a time, half hour at a time, whatever you want in anything. You can kind of just take it with you. That's the whole purpose. It's not just get better than forget about it. That's what pills are for. That's what medication's for. Get better, forget about it. You know, eventually you stop having to take the painkiller. That's not what this is. This is like learn it, embody it, and when you need it, you got it. It's there.
Yeah, absolutely. Love it. Well, awesome. That's what I wanted to get out on ramp. And I'm sure anybody listening or watching as we go along, more questions come up. Fantastic. Fire them into the community section, and we can expand further on all things on ramp. But let's get into a first question from one of the users. And that was, I'm going to butcher how I say their name, but Arona. They were asking, when exhaling and holding the stomach, do we keep the lengthened tension on the next inhale?
Yeah.
Or do we reset?
Yeah. Okay. That's a good question. I mean, so this is, a lot of people aren't going to be able to do like that, holding the tension throughout. You want to make sure that your body, the whole purpose of learning this is that your body's shortening from a longer place. So the whole purpose of teaching the abdomen in a decompression breath is lengthen it on the inhale. You're lifting the ribs, you're lifting the back ribs, you're lifting the skull, you're engaging the neck to lift with all of those tissues. And on the exhale, you're not trying to lengthen anymore. You've lengthened. You're trying to utilize this almost uncomfortable length as you exhale to train what the muscle is supposed to do when it shortens. And that might sound confusing, but that's using an eccentric tension, a muscle long as it can be. Your abdomen's as long as you can get it. You're exhaling, it wants to pull down, you're not letting it. And then you hit this point where it just kind of shortens a little bit. You have to let it hit that point. Otherwise, you're not fully exhaling. So that's, I think, the reset that you're asking me is like, do I fully exhale to the point that I actually have to let my abdomen relax a little bit? Yes, that's what I want you to do. If you're not letting your abdomen relax to some degree at the end, you're not taking a full breath, and it's not really like I don't know, it might not be very, very comfortable after a little while, if I had to guess.
I feel like I feel like in a sense of tension when going through it, especially if you're working on decompression, I feel like there is a degree of tension you have to maintain. Um, and I'm trying to in my head to think of it from like just a doing standpoint. Um, I always think of it as like I expand the rib cage and then I pass that burden off to the abdominal. I exhale, I'm lengthening, but I'm working to keep that expansion, that tension, if you will, that activation. But then as I'm exhaling, there's the lengthening. Yeah, and there is like a letting go of the like it is a to me, my brain goes, it's a back and forth. It's expansion, we maintain, we focus on the abdominal, we exhale, we expand. There's almost like a passive abdominal in that moment. But I always tell
You
people
need
if it's
that moment.
yes,
You
yeah.
need
But
that
I
moment.
tell everyone it's if 3 or 4 inhalations, you're like, it
Yeah.
it should be challenging. Absolutely, right? I mean, we're gonna say like it's very challenging. Um,
You're trying to drive your sympathetic nervous system with this. You're trying to make it uncomfortable neurologically to a degree. You're literally you're pulling your body apart. To your body, it's trying to resist that a little bit. It's hard. It shouldn't be easy. A decompression breath is an exercise within an isometric pose. It's a very difficult breathing pattern. But again, practice that last, like you're up, you're fully inhaled, you're exhaling, you go through it. All of a sudden, before the next inhalation, you have to allow the center of your abdomen to kind of drop down like an inch or so, a quarter inch, a fraction of an inch, whatever it might be. There's this little release before the next inhalation that has to be there. And that's what I want you to try to find with it. See if that makes sense as you do it.
awesome. Well, hopefully that clears it up for, and that is anybody wondering, that's a very common question. That's why I was really excited to thread that in here today, because we get it often of what's supposed to go on when I'm exhaling.
Mhm.
I try to tell everybody, as I went through the hard way when you were working with me in the early days, is it's one of the most challenging things to figure out in all of this, and it takes time. And just being patient with yourself, being consistent, use the ground. Like, I'm a huge advocate of supine prone, feeling where you're breathing, using the ground to pull away from. 8-point planks, I think, are a phenomenal tutor, as much as you may not want to spend time there. But someone
That's
had
the
asked a question
exercise.
too,
That's the exercise I need the most and I avoid the most, is the 8-point plank.
right?
When I'm regularly doing it, everything is just connected. Boom, 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 boom. Everything's connected. I
Yeah.
gotta do more. And
Well,
for
and
decompression, real quick, people can go back 10 years of stylized different styles of decompression breathing teaching. We've been figuring this out for a decade now. It is not an easy thing to teach. So there might be styles from the fundamentals processes. There might be stuff in some of our other workouts that detail these things differently that help you. Explore the app as much as you can. Do a search for Jessie's teaching. Do a search for my teaching. Do a search for decompression breathing. See the various ways that you can find the information on it.
yeah, there's going to be those aha moments the
You
more
can
you're
see,
doing it and watching. Go
go
ahead.
watch the TED Talk I did in November of 2011. That is decompression breathing. And I mean, it goes back a long way, and there's a lot of ways to learn it. And we've been trying to figure it out this whole time. Still
Yeah.
trying. So you're not alone in the challenge of this.
Yeah. Awesome. Well, and that was well, since we touched on the 8-point plank, I'd had a discussion back and forth with Daniel in the community section, where he was going, man, I'm really, I realize I'm doing so much pelvic tilting. Eric, can you just give a quick, because I said to him, hey, work in some 8-point planks before you do all your hinge work in some forward folds where you expand the rib cage, to which he's like, had so much awesome feedback about how he's progressed in using the app and how he's finally not needing a prop and forward fold. Congrats, Daniel. And I said, do more 8-point planks now. You're going to hate me for this, but start working more 8-point planks, focusing on that thoracic expansion, and then take that into every foundation practice for a little while. Become a master of that and see how it evolves you. Would you
He's
give any other
anterior.
exercises?
He's anterior pelvic.
I want to say he's anterior pelvic tilting.
So that's like sway back. That's like you're leaning into your hips behind you a little bit, kind of
Yeah.
forward. Yeah, 8-point plank is the king for that one. Spiral lunge is the other one that is so valuable for any kind of a scoliosis issue, any kind of a hip pelvic rotation issue. That downward anchor of the spiral lunge met with the rotation of the spine and the kind of the one side, then the other side lengthening of the lat. That's how you really change a pelvic tilt. You don't alter the pelvic angle at the pelvis. You pull apart from the bottom and from the top, and that straightens the pelvis under the tensions between those two. That's how you, so don't try to arch your hips this way. Don't try to arch your hips this way. Pull strong at the adductors as we instruct in anchoring, and pull broad at the back rib cage as we instruct in decompression. And that's going to start really leveling out the hips better for the pelvis.
Boom. Boom. Gold. Gold. All right. So let's go into, it was where did I put it down? Paz asks, when doing integrated hinges, should I anchor my feet, active legs, or have relaxed legs? I know what your answer is going to be, Eric.
If you're, okay, so depends on what part of the legs you're talking about, number one. Because if you're anchoring and you're squeezing your toes against the ground, then the very low portion of your calf and your ankle and your foot are super active and super tight against the ground. But the upper part of the leg is doing very little and probably being pulled in a way it doesn't want to. So your feet are outward spread against the ground, like they're trying to take up as much room as they can. And that should give a gentle contraction of the lower leg muscles and a much more focused contraction of the upper leg muscles. They're not relaxed. They're not dominating anywhere, except perhaps if you're squeezing in on the anchor, you feel the groin muscles, or if you're pushing out on the anchor, you feel the IT band specifically. You want your whole leg active like it's a hot air balloon rising toward your pelvis, leg to leg. You don't want it pushing down, squeezing the foot. You want it lifting towards the pelvis. That's the best I could do.
Yeah. I say, like, from a coaching standpoint, just so we're all clear, when we start rooting into those 3 points of contact, you're anchoring. And we do want to have that goal of finding those points. Notice when Eric talked about doing a gorilla lift, he was saying, I don't roll out to the edges of my feet. He's very cognizant of that anchor and of that strength. I'll say, I love cueing for people, like, okay, hey, we can find our integrated hinges, feel the back of the leg, right? We've got our initial hamstring activation. But I like to get people in the mindset of, like, hey, I'm keeping my 3 points. I've got that back of the leg in the game. Now, can we spread the floor as we hinge back? Can we find that outer anchor as we're integrated hinging? Awesome. Can we use the inner anchor on the way up? Like, this is why I look at this to start advancing the practice, if you will, for people, or if I'm in a private class, I might go, we got the outward, we got the inward. Let's play with all different variations, and then challenging yourself as you go along so that we learn to incorporate more muscle in the movements. Is it mandatory? No. Is the 3 points of contact suffice? Excellent. But that's where my head goes as a coach, and integrating. Do you have anything on that, Eric, for him?
No, if you want to understand why, probably listen to more of my stuff. If you want to understand how, probably listen to more of Jessie's stuff. Meaning, like, you coach it really well. You're succinct. You're boom, 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 boom. I'm gonna talk your ears off. You did it well on that one.
No, but I mean, no, but what I appreciate it. But there's I think there, as we've always said, it's why you and I work well together, is that you need two perspectives. You need to have an understanding of why for what you're doing. And then, you need to have those days where you're just getting into the grit of it. But I think, I always go back to learning from you. And when I'm learning the anchor, I'm like, okay, I want to make sure I can use them all. But really with you, I always started to recognize that I lacked on my inner anchor ability. So for me, it was going, yeah, I can go outward anchor strong, awesome, but I know what I need ultimately. It's like the 8-point plank. I know I need it.
Your telltale sign when you, and your body has changed, especially your leg angle has changed so much in the last like 6-7 years. You used to have that lateral powerhouse side quad, you know, that like big CrossFit side quad. And now your legs are like cylindrical tension. Yeah, that's
It
right.
used to be Quadzilla, and now I'm just little quad guy. No, well, hey,
No,
okay.
it's proportional.
All jokes aside. Well, Eric, so fast. Why you said this in a talk, and it's always stood out to me. I think it's phenomenal because it throws people through a loop, and I think it is counterproductive or counterintuitive to what most of us think in the world of strength. You had said the quads are not a primary stabilizer. So, would you give everyone real fast why my quad's getting smaller but more balanced to you means more power ultimately?
So your quads dominate movement at your knee, not at your hip. Your hip is the strongest joint in your body. Your knee is not. You need the muscles that dominate the hip to be much stronger and able to dominate the muscles that dominate the knee. The quads dominate the knee. The posterior chain dominates the hip. Bigger fish eat smaller fish.
Posterior chain for my dad, I like that. Figures, but a posterior chain for all you non-anatomy folks, backside of your body, big powerhouse muscles. Think of your butt, the back of your legs in this conversation.
So imagine, like, think of a robot. We're getting to see these really cool robot movements now. Go on YouTube and Google robotic movements, robotic jumping in particular. And what you'll see very quickly is the joint that does the most movement is the hip joint, pulling. And the knee absolutely counterbalances the hips drawing back. You need to have reasonably strong hip flexors, which feel like your quads because they're on the front middle of your leg, but they're not your quads. Your quads need to be stabilizing of the knee. And that is a big part of healthy movement, but it is absolutely nowhere near what happens at the hip. The forces, the propulsion, the knees kind of slow you down. They're a decelerator in a lot of ways, but they're not a primary mover. They're an accessory. I'm sorry, not the knees, the quads. The quads are like an accessory muscle to load a healthy posterior chain that does the propulsion, does the big movement. That's actually why, look, one of the healthiest programs out there for knees is that knees over toes program. You know what most of their program is? Posterior chain, man.
Walk backwards. Whoa.
They talk about it. It's very important to have a strong posterior chain. If you want healthy knees, you need a very strong posterior chain.
Yeah. I mean, look, the strongest my knees felt when I was in my heyday of lifting was when I was doing low bar back squats, which is a predominantly posterior driven, hip driven squat, you know, very little quad. It's wild.
A gorilla. It's a gorilla movement.
I do love that lift. So last one before we banter on where do we go from here. I have it as Arona again. I'm sorry if I didn't put the name down correctly, but hinging. Do we hinge during an exhale or an inhale? Basically, I know I have a personal one on this, Eric. I have a personal why that I give when it comes to breathing, but I know it's always been, do I put the chicken before the egg? Do I move, then breathe, then move? Do I hold my breath?
I'm going to let you go first.
Okay.
Your rationale.
I'll give you my rationale. And by no means is this the way to do it. This is just the way I like to do it. I'm a big advocate of breathe as you breathe. When we're going to go through a transition, I want people to inhale, make that movement transition, and then exhale once in position. Reason being the little bit of intra-abdominal and intrathoracic pressure that's created, I found through watching and through weightlifting, is that it provides a degree of stability where I didn't have as many people losing their big expansive, maybe the tendency to go into an extension would come out when we go into our hinge, whatever the movement might be. So personally, I've always encouraged people, take a nice big inhale, let's hinge our hips back, exhale, engage. And that's always been my mode, my why. But I want to say, I want to say Sean does it different. I don't know. That's just me. What are your thoughts there, Eric?
The body's a lot stronger and it moves a lot better with air in it, because it increases its surface area. It increases distribution of force throughout the body. You ever notice how easy it is during like a good wipeout or like a good fall? When you're falling, you're not breathing, you're holding your breath. And on impact, because you're holding your breath, it's really easy to get the wind knocked out of you. That's because innately your body holds its breath to be more reflexive, to be more dispersed and more able to absorb a fall. That's why even after you pass away, even you can still, the lungs are naturally going to go, and you can compress them and they're naturally going to go. That's just the way they work. And when you're moving without thinking of it, moving quickly or being moved quickly, unless something hits you at the ribs to push the air out of you, your body's going to go until that process is done. And I think that I use that, like, what do we do naturally? That's how everything that we've done in foundation training has come from watching a lot of animals and watching a lot of people and seeing the similarities and noting the differences. And one of the big things that I know is very few animals perform better with less air in their body. You know what I mean? Well, even on a minute level of, breathe as you go this way. I love what you say, which is just hold your breath until you're done moving. Like, take your breath at the next rep, but not, it's too quick of a movement for most people. You're that's like ventilating for a lot of people.
Yeah. I think if it's, if it's integrated hinges and that kind of stuff, inhale, come up, exhale. Inhale, pull back, come up, exhale. Or really, like we both do, is work on a little bit controlling of your exhales. I think everybody doing the work will find some form of benefit of just, if nothing else, working on 5-second exhales when you're doing your practice and build up to longer. I say, when you forget about me in a position or on stage or whatever we're teaching at, by the way, everybody, we all know how difficult positions get after a little while. There's been a few times with Eric back in the day where he'd be teaching a crowd and he'd forget that he had me in a founder or something. And 5 minutes later, he'd turn around and just be, "Oh, you're still holding that?" And I'm just like, "Duh!" But I would literally go draw out the exhale as long as I can, just to try to calm the nervous system down.
That's the skill. The skill, a lot for if we were to take the same principles that we use to train our muscles, which is like kind of reverse engineer their process and strengthen them from kind of back end in, from length to shortening, and then from shortening to lengthening. With the ribs, with the lungs, we want to be really good at exhaling so we can be really good at inhaling. It's two sides of the same coin. One of the best ways, one of the ways that seems very natural is to hold your breath, move through that rep, breathe. Another way that I love to play with when I'm doing this is hold my breath, move through a motion, or exhale through as many motions I can. So if I'm doing integrated hinges, I'm going to exhale for 5 of these.
Yeah.
So I take a deep breath in, and then the exhale is like, it's just going for like 30 seconds, 40 seconds, whatever it is. That feels incredible. Absolutely incredible. It's like meditation. There's a lot of ways to do this. There's not one way to do it. Just do do the hip biomechanics as well as you can. Do the foot placements and the head lifting and all those things that we tell you to do as well as you can.
Yeah, 100%. Okay, let's round this out, Eric. People want to know, where do I go after baseline? I've had a couple of different cool questions. I'll give you an example. One person was asking, should I get done with, well, now it's really beginner, intermediate, advanced. Should I go beginner and then work in the protocols? Should I go beginner, intermediate, get to advanced, and then do this? I've been telling people, get through beginner and then maybe start from the ground up the protocols. Or if you're an intermediate and you're going, hey, I feel good, I want to work in some strength stuff, fall into a flow where you're, working a couple days a week, intermediate and beginner workouts, 2 times a week, a couple things from the strength program. I've offered for the people in the advanced category, going Monday, Tuesday, Wednesday, going Monday beginner, Tuesday intermediate, Wednesday advanced, and then thread in a couple strength day protocols. I feel like the options are endless. I think it's really, my advice for people would be figuring out what your goal is. I love the idea of using the protocols to turn up the volume on the leg focus, the hip focus. What do you got for him, Eric?
So regarding the protocols first, I explained this talking to kind of a science guy the other day. I said, what people always talk about is the performance, like how do you position yourself for strength and this and that, and why is this angle so important? That nervous system is the exact same when it comes to sensing pain. So the back side of the column of the nerves senses pain. The front side of the column of the nerves gives the information for the muscles to contract. That's literally like saying, like looking at a garden hose and saying that, it's all the same pathway. So when we're looking at the protocols for pain, every single one of those will enhance your neurological performance and your muscle contractions in that same pathway. There is a very big misconception that in order to be very strong, you have to work intensely constantly. Some of the smartest work that you can do is like somatosensation, moving slowly through nuanced movement like ours and really understanding it. Then translating that, like you said, to an advanced routine. If you're a surfer, okay, spend a month working through the longest workouts you can find in the beginner series. Do a few of the longer workouts of the intermediate series, kind of sprinkled out. Just make sure that you have the capacity, make sure that it feels okay in your body, and then go straight to the surf program and play with those workouts. If those feel good, go, because of the similarities, go to the combat sports program, because you have to be able to move in these different ways, whether you're grappling the water or grappling an opponent. You have to have like these abilities to get into different things. So there's rationale in pain relief that absolutely expresses itself as performance without having to do anything different. Don't think you have to be an advanced because you've been doing foundation training for 5 years. In fact, I challenge anybody that has been doing this work for more than 5 years to spend this entire year between the on-ramp programming and the beginner programming. Because what you'll do is make all of the neurological connections stronger. You'll notice that you are not doing foundation training as well as you think you are, I promise. You need the nuance. We all do. I need Jessie to help me and coach me. He needs me to help him and coach him. We need the other instructors and they need us. It's an ongoing process. What you sense isn't always what's happening. So my take on this is foundation training is not the be all end all. You're not supposed to get your whole workout with foundation training. The purpose of the advanced routines is to advance your athleticism, to advance your skill in doing foundation training. It's not necessarily to give you the most intense workout you've had. So don't correlate those two exactly like that. It's all about practicing these patterns as well as you can, as frequently as you can. Any one of those programs, from golf to the desk program, to the running program, to surfing, to combat sports, if you want to get stronger, immediately go to the baseline strength program. That's the best strengthening program that's on the internet right now. I mean, at least in my opinion. It has to be somewhat in the top 3, just knowing what's in there and what the science is behind that. It's a phenomenal program. So you have lots of directions you can go. Then if you're getting a little bit bored, find a new hobby. Keep doing foundation training. It doesn't have to be exciting to do the work that you need. We'll do our best to keep entertaining you and keep it fun. We'll bring in new instructors. We'll tell you jokes. But you have to make your life fun and not demand that your corrective exercise, symptom management, and strength management routine be your be all end all in enjoying an athletic life.
Yeah. Like, I think whenever I think of this practice, I look at it as I'm setting a tone for how I'm moving for the day. I'm setting a tone for my posture. I'm setting a tone for my breathing. And then I'm getting on with it. And then I want to go and I'm going to say, like, I'm a huge, huge believer. I know you are too, Eric, of the idea that Dan John puts out there of punch the clock workouts. You already said it, but we do need to break that mold of the idea that every time I'm showing up for stuff, I need to be grueling and killing myself. I tell people all the time, do the fundamentals for the day, and then go for a walk, go for a hike, go do, like you said, whatever hobby fuels you. My fan is like, I'm gonna make it a point to swing a kettlebell 10 sets of 10 at some point. And it may be fast, 10 reps on the minute. That's fast for me. Or it might be I swing for 10 and I'm gonna walk around the yard for a little bit. And I'm gonna swing 10, I'm gonna walk around the yard for a little bit. I'm just gonna rev that motor, but never am I getting to a point where I'm just falling on the ground dying. And I don't think anybody should really approach foundation like that. Maybe once a month you have a workout you really have to gut it through. And by that I mean you're out of pain, you're doing it simply because you want a challenge, but recognizing more than likely you're going to fatigue and you're going to fall into poor movement patterns. You're going to be doing the work less ideal than if you were going for a 15 to 20-minute workout. Some people are sadistic. They like that sort of thing. But nonetheless, I think what you said, Eric, is on point. Is like, this shouldn't be the have all be all the time.
You do foundation training so that you can do the things you love to do. And you have any, like, some of the fittest people I know never go to the gym once. I know glass blowing artists with the strongest arms and the biggest lung volume and diaphragm I've ever seen. They're just like these barrel-chested people with these, they take a deep breath. They're like huge. They don't train that. That's their art. That's what they do.
Yeah.
They're like, there's things out there that are really fun to do and build strength and sensation and capacity while you're doing them. There's so many of those things. So I always tell people, find as many hobbies and learn as many things as you can, because that's how you kind of stay healthy.
Spot on. So on that note, Eric, what comedian are you currently hooked on? Anybody doesn't know, Dr. Goodman has a huge love for stand-up comedy. And within the next 5 years, he's going to do some stand-up for us somewhere. I'm putting this out there now.
Really?
He's got 5 years. 5 years.
But
Eric,
I'll do some. I'm gonna break the mold.
There you go. Let's get uncomfortable.
Who's my favorite right now? I don't have a favorite right now. You actually introduced me to Matt Rife, who's very funny. But I kind of watched a few of his things, and I got, okay, he has like a very defined style, and he's still super young. I can't
put a face to him.
He's the really like stud looking guy. He's a young guy. He's hysterical.
Oh, yeah.
His act is literally about him being good looking.
Yes, it was so good.
But I got to tell you, I went into his act. He's a funny guy, a very funny comedian. Who else am I really into right now? I like Bill Burr. I've always liked him. I like Tony Hinchcliffe. His show, he has a podcast called Kill Tony. Anybody I'm like, I love helping people feel better. And I always say laughter is the best medicine. And sometimes laughter can be cynical and absurd and obnoxious. And it's a perfect example. But I watch his show every time it comes out. Like, he's hysterical. Who else am I super into? I like to go back to Richard Pryor. I like to go back to Rodney Dangerfield. And these are the people that I grew up with and always was watching, helped me get through a lot of my own mental challenges and my own hard times growing up and stuff like that. So I don't know, laughter is the best medicine. Foundation training is the best posture medicine. I'll try to think of a few funnier but not as well-known comedians that I pay attention to, and for the next one we'll talk about those. Even a few like they're pretty good out there. Chris DiStefano. This is the one.
Yeah.
I can't believe there's not that many people that watch it. Chris DiStefano has this unique niche. He's like a history scholar and he's a physical therapist. I like this dude. He's got a brain. Yeah, physical therapist and a history scholar. Very, very funny comedian, but he has this thing called Christeries, where he goes and gives these very compelling portrayals of like famous people in history and famous processes in history. And it's hysterical. I don't know. If you're a history person, it's hysterical. If you like history and comedy, go listen to Chris DiStefano. He's very funny. Very, very funny.
I had no idea that was his background, but that's pretty awesome.
Yeah.
Wow. See, learn something new. Well, there's the recipe from Doc Goodman. Do your foundation every day. Listen to something funny. And I'm going to say, anybody that's watched this to the end, share in the comments below your current favorite comedian. And on that note, Eric, my Mac is letting me know that it's going to go to sleep soon. We should probably wrap this up. Anything you want to leave everybody with, Eric?
let us know how we can do this better, because we want to do this a lot. And I think this could become something that's very valuable for the app. So let us know what we can do better.
There it is. All right, everybody. Thank you so much. Catch you later, Eric.
See ya.